family and friends, get their hair cut, sit at a restaurant or see work colleagues. Melissa Valenti from Sydney's Inner West is nervous about what easing restrictions will mean, particularly as her 2 young children can't yet get a vaccine.
And I'm actually quite apprehensive, having been in lockdown for so long and I suppose conditioned to not going out, not mingling in crowds, not seeing people standing far apart, and it just sort of feels like the floodgates are going to open up.
Brooke Nerthen from Sydney's Sutherland Shire feels the same.
Yeah, it's going to be really weird. Like, it's just going to be bizarre for the first time being around lots of people, and you know, things like just people coughing now in my sphere is like a bit triggering, you know.
And it's not just the adults with some readjusting to do. Brooke Nerthen's 5-year-old boy is going back to kindy on the 18th of October.
That's really nerve-wracking for him too. You know, he's had months and months off school now, so he's feeling a bit apprehensive about that as well.
Cognitive neuropsychologist from Swinburne University, Professor Susan Rossell, says there is a scientific explanation for that feeling.
So a lot of the hormones, the neurotransmitters that would be fluctuating in quite large degrees pre-COVID, they've all gone into a little bit of hibernation. Same as maybe if you've been in prison for a long time or, I don't know, lost on some kind of tropical island. And actually, for many of us, these new experiences become, they're new and they're foreign again. So basically what we're seeing again is threat responses.
The good news, she says, is that our brains are remarkably adaptable.
This isn't something that we have to put, I guess, too much impetus on. So we just need to make sure that we're kind to our brains and give ourselves a bit of a break in between those exciting times of going to see family and friends.
And in breaking news, the government has announced that Northland will move to alert level 3 tonight. That will happen at 11:59 this evening following recent information on the risk presented by a positive case. This is a person who was tested earlier in the week in Whangarei and their positive test result confirmed in Auckland yesterday. The person's now in managed isolation quarantine in Auckland. Now, they say that the case appears to have travelled extensively around Northland after travelling there on the 2nd of October. Restrictions will remain in place in Northland until 11:59pm on Tuesday, and the Auckland boundary will stay in place. In terms of the travel, the information that they have at the moment is that they were in Northland, this person, between the 2nd of October until the evening of the 6th of October. They are believed to have travelled around the region, including to Whangarei, Kamor, Paihia, Kawakawa, and then returned to Auckland. Now, Chris Hipkins, the COVID response minister, says it is unusual to put a region into alert level 3 when there are no further cases. However, it's vitally important that we get ahead of any potential spread and set up widespread testing and continue contact tracing efforts. They have already identified some locations of interest, so we direct you to the Ministry of Health website there under locations of interest, but the ones to hand are the BP Connect on Wiley's petrol station at 49 Monu Road, Woodhill, Whangarei, and this is on the 2nd of October from 11:20pm to 12:20am on the 3rd of October. The Z at Kensington Service Station, corner of Kamor and Nixon Street in Whangarei, from 3:45pm to 4:45pm on October the 4th. Those sites are on the Ministry of Health website under locations of interest. People are being told to stay home and get tested as soon as possible if they have any symptoms, and to continue to check the website for locations of interest and in
Kia ora everybody, good evening. Ministers convened this evening after receiving additional information on the movements of an individual who travelled to Northland this week. Based on advice from public health officials, we have agreed to move Northland to alert level 3 from 11:59pm this evening for an initial period of 4 days until 11:59pm on Tuesday night. Cabinet will review these settings when it meets again on Monday. This measure is being taken out of an abundance of caution, given that there aren't, at this point, additional identified cases in Northland that we are aware of. It is also being taken, however, because the individual has not been cooperative with contact tracing efforts. We haven't been able to identify their exact movements, and we do have some information to suggest that they were not travelling alone. Our understanding at this stage is that the person was in Northland from the afternoon of the 2nd of October until the evening of the 6th of October. Based on information from the police, we believe they've travelled widely around the region, including in Whangarei, Kamo, Paihia and Kawakawa, before returning to Auckland. Initial locations of interest, the BP Connect at Wiley's, at 49 Manu Road in Woodhill, Whangarei, between 11:20 p.m. and 12:20 a.m. On the 2nd and 3rd of October. At the Z Kensington service station on the corner of Kamo Road and Nixon Street, Whangarei, from 3:45 p.m. to 4:45 p.m. on the 4th of October. The other factor that we have taken into account is that vaccination rates in Northland are low compared to the national average, and without placing restrictions on movement, there is a possibility that the virus could spread quite rapidly within the community. Vaccination rates in Northland sit at 70% for first dose and 48% for second. For Māori, that rate is lower at 52% first dose and 32% fully vaccinated. Similar to our recent move to Alert Level 3 in the Waikato, cases spreading at Alert Level 2 are a risk that we cannot take. But it's also further reason why we need to really focus on vaccinations. Without high vaccination rates, we'll need to continue to use restrictions to stop the virus spreading. So I have two things to ask of Northlanders. First, if you have any cold and flu-like symptoms, please come forward and get a test as soon as possible. Testing centres are operating throughout the region, including at Kaitaia Hospital, one Samari Place in Kirikiri, the Dargaville Hospital and 20 Winga Crescent in Kamo, and Pohi Island in Whangarei. Also keep checking the Ministry of Health website, where we will update on any further locations of interest as we manage to get that information. The second request that I have is, and I can't stress this enough, is please get vaccinated. These cases do highlight the risks of COVID-19 to the unvaccinated. Anywhere in the country, we've seen the Delta outbreak jumping borders and finding unvaccinated people. I know a lot of people are happy to get vaccinated, but they're waiting, saying that they're not quite sure whether they're ready to get vaccinated yet. With low vaccination rates across the Northland region, now is the time to be vaccinated to protect your children, vulnerable people in your communities, your elders and loved ones. Information on vaccine centres on vaccine centres that will be available over the weekend is on the HealthPoint website, and you can also go to bookmyvaccine.nz to see what locations are available close to where you live. A reminder that Alert Level 3 means that you need to stay in your bubble and stay at home. You need to limit your movement. That's how we'll break the trains of transmission if any have already been spreading within the community. So please don't go and visit family, friends and neighbours. This is a virus that can spread quite quickly, and that is part of the way it spreads. We do need you to stay home, to get tested and to get vaccinated. Jessica.
So Northland has been left in limbo for many hours with no locations of interest, no indication about what's going on. Why did it take so long?
It has been very difficult to get information about this particular case. The first test result we had was what you could describe as an indeterminate test result. So it was quite difficult to locate the person. The information that they supplied when they were tested the first time did not provide sufficient information to be able to contact them with the test result and get them back to be tested. It took quite some time to track them down. The police ultimately were able to assist there and it did help to track the person down. We then had to get the second test result. They have not been particularly forthcoming with their movements.
Has the person got gang affiliations and are they cooperating with the process?
The person's not cooperating with the process, and I don't have any information to suggest at this point that there are gang affiliations.
So what do you mean by that, though?
I don't have information one way or the other to confirm whether or not they're involved in a gang or have any connection with a gang. That information has not yet been determined.
I'll
come over to you.
What are the reasons and rationale for not cooperating with health officials?
Well, they haven't given one, and so at this point I don't know why they're not providing the information.
Why was the person allowed to travel to Northland and back to Auckland?
My understanding was that the person, my understanding at this point, and I want to be clear that this is not yet verified, is that the person obtained a document by providing false information in order to get the document to travel across the border. By the time the falsity of that information had been identified and the doc had been revoked, they were already in Northland at that point.
So what were they doing in Northland? What was the purpose of them being up there?
I don't have that information. They have not supplied the reason. If this is correct, that the travel document they obtained was under the social services category, and that when the evidence that they supplied was reviewed, that exemption, that permit, if you like, to travel, was revoked. I'll come up to you. Sorry, Amelia.
Do you have any idea of the number of contacts it has? You said it's travelled widely, but do you know ballpark figure?
No, we don't, and that's partly because the person themselves hasn't been providing that information. The information that we have has been what the police have been able to identify so far using their networks, and so at this point the information's still pretty patchy.
And the person that they travelled with, are they also in managed isolation now?
No, and it's been very difficult to identify who that person is. My understanding, and this is only very recent, so I haven't been able to verify that, is that person has now been identified, and so work will be underway to try and track that person down.
Do you know where they are?
No, I don't, sorry.
So can I just clarify
Jessica.
a couple of things? So is the first person a woman or a man?
My understanding is that they're both women.
Okay, and I mean, if police had to step in to help, one could assume that they have gang affiliations.
Not necessarily. This person, from what I gather, is just not being cooperative and is not providing information. And the police are involved in the process where that happens, so that we can try and get as much information as we can. And the police, of course, have an ability to access other sources of information, CCTV and all of the other sources of information the police might have access to.
If the person is not, if they're not going to be cooperative, at what point do you consider releasing more information about the person so that anyone that's been in contact with them can self-identify and come forward to you instead?
I wouldn't take that off the table. We're not at that position yet. The police are involved in helping to try and get information, but at this point we're not at that stage yet. But I certainly would not rule that out completely. That if we'll share information that we have. And I just have shared the information that we've been able to piece together, and we'll have to continue to do that. In some cases, you do need to move quickly in order to give people that permission. They need to travel across the boundary, but of course we'll certainly keep looking at that.
Minister, we've seen, you've outlined that this person basically frauded documents. They've been uncooperative with police. You and Cabinet must be furious. What's your thinking at this stage?
Look, it's very disappointing. By and large, we've seen good cooperation amongst New Zealanders who have contracted COVID-19. Again, it's worth remembering and worth reminding ourselves all of the time that COVID-19 is the problem, not the people. People can be the solution. And, no, I'm not.
New South's been told it is that the woman is a sex worker. Can you confirm that?
No, I can't.
Do they have a criminal record of any kind?
I don't have that information.
But you must have theories about their intentions in the north.
Oh, look, we can all have theories, but I don't have any confirmed information on that.
Officials that are very well placed to make those assertions, they must be well known to police, this person?
Look, I don't have that information.
Do you know their names? You seem to not know much at all.
No, I don't know their name, no.
Just to be clear though, you haven't been briefed about what they do for a job or that they are sex workers?
No, I have not had that information, no.
Would you expect to, if sources are telling news outlets that, is that something that you should be briefed on?
We generally don't get people's occupational information unless it's directly relevant to the investigation. And at this point, I haven't got any information to make a judgment either way on whether it's directly relevant to the investigation or not.
Are you worried that there will be more cases like this, with Auckland being in restrictions for so long, where people will...
And that we don't at this point have other positive cases. One of the reasons that we're moving to level 3 is if further positive cases come to light in the next 24, 48, 72 hours even, to move at that point means we've lost valuable time. And so we're doing this now so that we don't find ourselves in that position.
Do you expect more cases involved?
I think it is certainly very possible. If we don't see additional cases, I'll be very happy, but it is certainly very possible. We wouldn't be doing this if we didn't think it was very possible that there would be more cases.
Did she provide a contact? Because there was a weak positive case, and then when she was let go, it's probably normal procedure. Then she provided contact, which then turned out to be false.
My understanding is that the phone numbers and contact information provided when the person went to be tested, they did not. The phone numbers were not valid, and it was very difficult to locate the person. That would appear to be the case. Yeah.
Would the government consider offering immunity from any criminal charges in exchange for cooperation, if that was what was needed to sort of encourage this person to actually tell officials where they'd been?
Let's be very, very clear about this. Our public health officials, when they are interviewing people and as part of contact tracing, do not use that information for any other purpose other than eliminating the risk of COVID-19. They don't share that information with the police for the purposes of criminal investigation, for example. Where police are involved, it is because we need the police to be involved to help us get information, but the public health teams are not collecting information that's then passed on and used in a false positive, or it was a historic infection. And we do see those get thrown up from time to time, and the answer there is to find the person and to retest them, which is exactly what the team were focused on doing. But moving up alert levels every time there's a potential false positive would create a huge amount of uncertainty, because they do spring up on a relatively regular basis.
Zooming out a little bit, the lockdown area has now expanded to 3 new regions over the space of the last week. Is it, there are rule breakers, there's gang involvement. Is it a matter of time before the virus spreads to other nearby towns and places? Should Kiwis mentally prepare themselves for a degree of lockdown or a degree of delta in their communities sooner?
Look, my advice to all New Zealanders who are following this closely, I'm sure, is that getting vaccinated is the very best thing that we can all do at this point. There is the possibility that COVID-19 could pop up anywhere. That is the risk of dealing with a human virus. We do everything we can to avoid that from happening. We are absolutely working around... No. Last couple of questions? Yeah.
Do you know the residency status of this person?
No.
Do you have a sense of how close, if close at all, the police are to locating the woman's contact?
My understanding, this was only in the last sort of, very briefly before I came down here, was that identified who the person was. They may have some information on their whereabouts, but I don't know the answer to where they are, but they were getting quite close to being able to find that information out.
In Auckland or in Northland?
That is my understanding, is it's likely to be Auckland, but I don't have